Carolyn, you and I are both prevention researchers. When we're with our colleagues in pediatric brain injury, sometimes prevention isn't front and center. Where does prevention fit in this concussion story?
Well, as some of my colleagues say, I don't think we're going to be able to treat our way out of this concussion problem globally. And so I think prevention across the spectrum is so important. And actually, we can have a bigger impact with primary prevention. So I think we need to, still do what we do, and continue to engage early career researchers in this space, whether they're clinicians or not clinicians. I think it's such an important thing from a transdisciplinary perspective to bring lots of different disciplines to the table. And you and I know we can have a huge impact in this space, in addition to all the amazing work that's going on in the treatment space.
Well, I think clinicians and other scientists that work with families or work with patients, they get asked prevention questions. And so I think they're in a position to be able to convey information to families. So I think it's important that the research we do about protective equipment and other prevention strategies is in the hands and the minds of the people that are frontline with our families and our athletes and our students, because they're the ones being asked the questions. And so we need to make sure they're armed with answers.
Absolutely. And we understand from our youth that the people they listen to the most are their peers. And so we need to think about it at all levels in terms of sport, for example, and of course, non-sport related contexts, partners and industry community, as well as youth and parents. And I think that it's really important when we have an opportunity to talk about concussion management, which is often the priority in a lot of these spaces, take that opportunity to also talk about prevention. And I think people are surprised that we actually have so much evidence to support what we want to really communicate out there into the hands of partners broadly.
Yeah, I think it's an evolution of the thought that these events are accidents and thereby not preventable to these are events that we know things about and we know how to prevent many of them, and just getting those strategies widely disseminated to all different pockets of folks, I think is really important. And that communication piece is critical. That I think, I'm an engineer, communication and dissemination of our work isn't always front and center to what we're doing, but our work kind of lays on a shelf if we aren't communicating it in a way that the youth, the families know how to digest it and use it.